Hello everyone, Luke here with the Knee Replacement Therapists. For this video of the Need to Know Show, we're going to talk about NSAIDs and their pros and cons in relation to knee replacement surgery. Hey everyone, so for NSAIDs, what we're talking about, of course, is non-steroidal anti-inflammatory drugs. So basically anti-inflammatories, drugs that you take over the counter typically, but you can also get prescription drugs, medicine, orally taken, typically pills for decreasing inflammation in your body and decreasing pain through the decrease in inflammation. So some of the pros, some of the positives, of course, is that these drugs can be beneficial and can be effective in reducing inflammation and in turn reducing pain levels. Different types are aspirin, ibuprofen, Dapro, naproxen. So again, these drugs are typically taken by mouth orally. They typically last for a couple of hours or so, and then they move through your system. So then you have to take some more. And they can be beneficial, help with pain management, help with controlling inflammation. Now, the thing is that this benefit in pain relief is typically very short-lived, very short-term. The benefits are very good maybe the first couple of times, the first day or so that you use them. If you tend to use them for long-term use, the benefits and the relief, the pain relief, tends to really diminish over time. So typically if you're getting up into close to 2 weeks or over 2 weeks of using them, you're really starting to get diminished returns, less benefit in terms of pain relief, and less benefit in terms of feeling better and moving better. So that's one negative, is after using it for a week, 2 weeks, you're going to really not really feel the benefit, feel the relief of pain by using them. And the other thing is there's a lot of risks involved with prolonged use of NSAIDs. Part of it is with risks to your stomach, so getting upset stomach ulcers. There's also risks for cardiovascular system risks with long-term use of these drugs. There's the risk of causing dysfunction and problems with your kidney and livers. So really a lot of negative risks involved with using these drugs long-term and this medicine long-term. Some other things that are noteworthy is that they may also be linked with delaying your body and your tissues' ability to heal. And this is potentially due to the fact that inflammation is your body's natural way of tissue healing and recovery. Inflammation is the very first step and the important step in bringing cells and nutrients and the important things for tissue healing. So if we repress that, it may cause and potentially cause a delay in your ability of the tissues of your body, the soft tissue structures, to heal and recover. And so all these things kind of considered, the risks, the benefits, really NSAIDs, non-steroidal anti-inflammatory drugs, are good to use short-term, maybe an acute flare-up, so to speak, a day, a couple of days, but it seems like in the long term, using it more than that long, you're going to get diminished returns, you're really not going to get as much pain relief, and you're also increasing your risk of a lot of negative things as well. So that's kind of the overall story on NSAIDs. Of course, I'm not a medical doctor. I'm not a pharmacologist. So please, this is just me providing informational resources from what I've read, what I've heard. But that's kind of my overview on the pros and cons of anti-inflammatory drugs. This has been the Need to Know Show. Thank you very much for watching, everyone, and take care.